we're going to look at the von Willebrand's disease. And to start off with some questions, the first question is what is the platelet count? And the second question is how is the PT and PTT levels? So in this video, we'll find the answers to these questions and learn in detail about this topic. So to begin with, firstly, what is this defect of this von Willebrand disease? So the defect is nothing but there are many types. The type 1, type 2 and the type 3. So now we are looking at the type 1. Type 1 is nothing but there's a partial quantitative. There's a partial quantitative deficiency. So there's partial quantitative deficiency, and this is of the von Willebrand factor. So now we'll look at the second type. How is it different from the second type? The second type is it is a qualitative. So this was a quantitative. This is going to be a qualitative. It is a qualitative defect of the von Willebrand factor. Now we move on to the third one. The third one is a complete. It's a complete qualitative. It is a complete quantitative deficiency of the von Willebrand factor. So now we saw what is the defect like, and before that we also need to know what is the inheritance pattern. So the inheritance is nothing but the most common type 1. So most common is type 1 and it is autosomal dominant. Then we look at what is the mechanism of this. So what is the mechanism? So the mechanism, it includes, there are two mechanisms. The first one is that the platelet adhesions. There is the platelet adhesion. So the platelet adhesion defect is due to, it is due to the absent. It is due to the absent. There is absent. So there is an absent von Willebrand factor. There is an absent von Willebrand factor that normally. So what it does, it normally binds to the GP1B 9 and the collagen in the subepithelium and the collagen. Also the collagen in the subendothelium. Now we are looking at the second mechanism. So how does the second mechanism function? So in case of the second mechanism, we are looking at the factor 8. So the factor 8 here, deficiency, the factor 8 deficiency. So this is as the von Willebrand factor. The von Willebrand factor prevents its degradation. It prevents its degradation. Next, we'll move on to the platelet count. So how is the platelet count? So the platelet count here, it is that it is normal. It is normal, but there is an exception, that is except the 2B. Except the type 2B, except in 2B. So there is thrombocytopenia. There is thrombocytopenia. And then we have the platelet morphology. The platelet morphology, it is normal. It is normal, or it can be large as well. So beyond this, we are going to look at the bleeding time. So what does this bleeding time include? So the bleeding time, as we know, it is prolonged. And what about the platelet aggregation test? The platelet aggregation test. So as we know, this test, it includes the collagen, ADP and the thrombin. So all this is within the normal range. So it is normal. Next, we look at the ristocetin. So the ristocetin aggregation test. So the ristocetin aggregation test, so this is abnormal. So this is nothing but abnormal, and it normalizes after the addition of the normal serum. So it is abnormal and normalizes. So it normalizes after the addition. So it normalizes after the addition of the normal serum. Next, we look at the von Willebrand factor levels. So what about the von Willebrand factor levels? So von Willebrand factor level, it is nothing but it decreases. And then we move on to the PT and the PTT. So what does this do? There is a PT which is normal, and the APTT. There is APTT, and this is basically prolonged. Now we are going to go back to answering our questions. So here, the first question we did was, we asked was how is the platelet count? So the platelet, if you see, it is normal, but except, so there's an exception. So except the 2B, so the 2B, it has something known as the thrombocytopenia. It has the thrombocytopenia. And then we also asked, how is the second question was PT as well as the PTT. So here the PT is normal, whereas the APTT is prolonged. So this was about the von Willebrand's disease. To grow daily, do subscribe.